Military Culture Series. Today's webinar is Understanding Gender Differences in Military Populations, a Behavioral Health Perspective. The presenter today is Ariel David, and she is the project coordinator of the Armed Services Network of Louisiana, an initiative of a community coalition, the Jefferson Parish Alliance of Concerned Citizens. The network addresses the needs of Louisiana service members and veterans. Now, previously, Ms. David served on active duty in the U.S. Navy in the field of aviation and combat operations. She's received multiple awards for her military service, including both Army and Navy Achievement Medals. After spending 8 years in the military, she now focuses on coalition building and community advocacy and development with a special focus on unique subpopulations, and she also serves on the board of several Louisiana nonprofits and is a founding member of an international aid organization. So at this time, Ariel, I'm unmuting you and turning the screen over to you as well.
Great. Thanks so much for having me, everyone. Let's see if this works. Okay, so yeah, so like we talked about, like was said earlier, this is Understanding Gender Differences in Military Populations. I am going to be, hold on one second, there we go. All right, so I'm going to do a little disclaimer here because I'm going to be talking about some pretty unique issues with military service. Specifically when I talk about the realities of military service, I'm in no way, shape, or form trying to disparage our military. Obviously not. I am a veteran myself. But there are some very interesting things that are going on right now with our military women along with our veterans. So we're going to cover the realities of military service. We're going to cover some of the gender disparity and discrimination that's going on, along with some racial and ethnic disparities, as well as selected behavioral health issues of women, and then women's health services needs and delivery. So, why are we having this conversation? Our military women, it's actually the fastest growing population within the military, within the DoD, is women. They are a targeted population for recruitment by the DoD, and for retention, because currently retention rates are very, very low. Of all of our military branches, the Air Force and the Navy have the most women. Among active duty women in the military, it's very interesting to look at like some of the demographics and what actually women in the military look like. Marriage is actually less common for military women than it is for military men. 46% of active duty women are married compared to the almost 60% of active duty men. And one thing that's really unique about that is that almost half of all military women actually wed another service member, while military men, their share of dual military marriages is only right at 7%. And also, not only are active duty women more likely to be unmarried, but they're also more likely than active duty men to be single parents. 12% of all military women, both active and reserve, are single mothers, and only 4% of all military men are single dads. So in Louisiana, we have quite a substantial veteran population. Around 7 to 11% of these veterans are female. More recently, the survey and the estimates, the census estimates, show that it's growing. There's also at least 5,900 service women that are living within the state. That number, of course, is always shifting and changing because of the way that active duty billets, active and reserve billets operate. Military women are always moving and changing, and there's always shifts in the population. So 46%, I want to make sure I emphasize this, that 46% of all Louisiana female veterans are around between the ages 35 and 45. The fastest growing age group of women veterans is between the ages of 17 and 34. That's currently 21% of our population, of the veteran population in Louisiana. All right, so I think it's very important when we're talking about the cultural nuances of the military to be aware of the historical context of women in the military. And specifically in order to better understand the historical context of sexism and gender prejudice within the military social complex. It's women in the military is, well, while we've had women serving in military operations since the Civil War, when we first started seeing women dressing up as men in order to serve and in order to receive benefits after their service. In reality, it wasn't until 1901 that the Army Nurse Corps was established. The Navy was the first branch of all of them to involve women in jobs other than medical. So yay Navy. By the beginning of World War II, women were filling the roles of many different job fields. It wasn't until 1948 that women had a permanent status in the military. There was still the 2% ceiling, though, on the number of women in the military, and it restricted promotions. And it wasn't until 67 that the legal ceilings on promotions was changed. Of course, we all know that last year the DoD lifted the ban on women in combat, which allows them to officially serve on the front lines. This year was the first year we actually had women deployed to combat in combat operations as combat operatives. Okay, so this is a really interesting complex that goes on. I really love, there's a huge study that goes on, that's been done about military culture and how it incorporates the masculine role of soldiering. And basically this is just a really, really great way of saying that the military is a man's world, and it has always been, and it still is that way today. So there's some really unique differences between men and women in the military. It's very, military women, they're more diverse. 3 in 10, 31% of all military women are black, including black Hispanics. It's almost twice the share of active duty men who are black. The same with Hispanics among men and women. Those rates are similar. We're seeing some very unique things in terms of recruiting as well. Right now, the population, the demographic that's most likely to enlist, and is of women, specifically of women, is 17 to 19-year-old black and African American high school graduate women, girls, females. So this is much different than we see with the men. The men are very, the number of men who are the diversity of the male veterans and service members is just completely different compared to this. It's really interesting. You can look in this chart and see that. This was done a few years ago, the survey of racial attitudes. I think this is very important when talking about things like promotions within the military. The survey of racial attitudes was conducted of active duty military members, and it showed that 75% of all people of color reported that they experienced racially offensive behavior, and then less than half expressed confidence that complaints of discrimination were thoroughly investigated. This is important specifically because they spoke and they surveyed women of color within the military, and they actually reported on it, which doesn't happen very often. There's not enough data on what's going on with our women in the military, and especially what's going on with our women of color in the military. Black women, you can see right here, black enlisted women were more likely than any other racial group to be in functional support and administrative specialty jobs, especially compared to whites. Black personnel were also more likely to be in supply or service specialties, and less likely to be in electronic, electrical, or mechanical equipment repair, or any kind of combat-related issues, specialty jobs. Black women and men are both underrepresented in the officer ranks. They are less likely to have been commissioned through academies, and the average age of black officers is significantly lower than white officers. Specifically, it's even these rates are even lower for black women. Black women officers are less likely than any other group in the DoD to be promoted, and they're also more likely to leave the service earlier due to what's called the up and out system. The up and out system is the system that the military has in order to if an officer doesn't advance, then they're not allowed to re-enlist. So basically, if you aren't going up in the chain, then you're getting out. This is also interesting given the fact that it wasn't until, a lot of people don't realize this, but it wasn't until 1996 that supremacist groups and neo-Nazi groups were specifically banned from joining the military. It is a lot of the counter arguments against this study were that women, specifically black women, were disproportionately in support operations rather than what's called the tip of the spear combat fields. Because of the combat, the regulations on women in combat, and men who are in combat operations are more likely to promote because they're faster pace to promotion. It's a faster track to promotion for combat operations. This is just a chart about the occupational roles of women and men. You can see the differences between the types of jobs that women and men do. It's also really interesting to note, although this chart doesn't show it, but 61% of all women, enlisted women who serve in the DoD, are only in the pay grades E1 to E4, which is the 4 lowest pay grades within the military. And actually, only 42% of enlisted men are in those pay grades. So I want to make sure I touch on combat exclusive billeting. With the combat exclusive billeting, prior to the deregulation of women in combat services, bureaucratic maneuvering has allowed the military to utilize servicewomen's labor and services in combat situations without actually having to recognize them as combatants. This is very important to understand. We have had women in combat for many, many years. We just never recognized them as combatants. My last deployment was actually in 2000, and I came home in 2010. It was an 11-month deployment to Baghdad, and I was considered a defensive operative. So even though I was boots on the ground, and I served with 50 other men, both Army and Navy, I wasn't considered defensive. So actually one of the stories I like to tell is how after our first engagement, after we arrived in the country, our first engagement with enemy forces, we came back to our home camp, our base, and everyone was awarded, every male was awarded their combat action ribbon, which is the military award for having served in a combat operation. And I was not allowed to receive one, even though I was there with them, because of the fact that I was considered a defensive operative, not a combatant. These bands have never, ever protected women in combat, but have actually denied them, like they did me, recognition of your service in combat. So the military has, obviously they have policies on sexism and harassment, and they have equal opportunity policies. However, it's important to keep in mind this combat masculine narrative that goes on, where actually sexism within the military is pretty prominent. A third of all female military personnel report high levels of stress as a woman specifically, and those are specific to the fact that they are a woman. They report more stress due to problems with coworkers and supervisors, and report unwanted sexual contact. It's actually higher for the Marine Corps when it comes to sexual contact. So this is a really great example of that. A lot of people don't believe me when I say that. They're like, oh, that couldn't be. But the reality of it is that there's no such thing as HR within. There's no human resources. There's no accountability in that sense within the military. They have policies about this non-discrimination, but they're not enforced. When I was in the military, we had pornographic images posted on the wall in our shop, in our workplace. It was normal. The men used words degrading to women. They talked about their conquest, their sexual conquest the night before. There really is no HR, any type of enforcement of this. They're getting better over the past 3 years. They've gotten a lot better at it, talking about making safer spaces and improving the climate for women within the service members, and specifically for certain commands. But a lot of those are on the command level, so on the local level. This Facebook page is actually the official Navy Facebook page. And I actually pulled this down like 3 months ago, I think it was. And you can see the comments on the official Navy Facebook page of all of these. And these are all either veterans or military members, except for I think one. And you can see, if you can't read it, I'll read them out. We have one that says, women don't belong in the military. You have another that says, not sure what's heavier. You have another one that says, funny how it's a girl on the hose. Oh, and they didn't look so good when I was in there. And shake it but don't break it. So this is another one of my favorite examples. And this has a lot to do with like how our society perceives women in the military. When you type in soldier into Google Images, try it once. You have to get down to like the 12th image before you actually see a woman on the page. And interestingly enough, the woman isn't actually even a soldier. It's Parish Jefferson, like hanging all over, a male soldier in combat gear. And then when you go down to the next one, it's a civilian woman hugging her husband. And then the following one after that is a woman in, I'm going to see if I can point at it. Here we go. This one. This is my favorite one. It's a woman holding a grenade launcher with ripped tights and shorts on. It's great. And that just speaks to me, that speaks a lot about how our society not only perceives women as combat operatives or as military members, but also perceives women as a whole. So I like to talk about these two women because nobody ever seems to know who they are. And that's really interesting to me. Shoshana Johnson is the woman on the right. She is an immigrant American, and she joined the military. And actually, her service, it's actually really interesting. She was 31 years old when this photo was taken. She served as a cook in the Army, and she was injured in the same operation that Jessica Lynch was captured in. But what's really interesting is that like no one knows who she is. The other woman is Laura Paitasawa of Arizona, and she was also in the exact same convoy as Jessica Lynch, who several years ago, I'm sure most of you are aware, she was captured. She was the first woman service member who was captured during the War on Terror. So, but what was really interesting is that Jessica specifically, on the left, she was actually killed. She was wounded and killed in captivity. She was captured as well. And there was absolutely no media coverage on these two women who were in the exact same operation as Jessica Lynch, but they weren't viewed as valuable media commodities. Actually, the treatment of these women really indicated, not only these women, but also Jessica Lynch, indicated that race was a key factor. Not only race, but appearances was a very key factor in creating a narrative of what our about what our service women look like to the American public. It's also really interesting to note that both Shoshana and Lori were single mothers. Jessica Lynch, however, was not. She had no children. She had not been married. She was young. her youth and innocence made her a very attractive candidate for the role of the damsel in distress. She was very easy to market. Her story reproduced familiar images for American history and long-standing popular media accounts of other women. There was one way I like to put it is that it just seemed like a modern version of a 17th century captivity narrative, which featured a white woman in peril who was captured by savages and rescued by heroic American men. So interestingly enough, when we go back to talking about Jessica Lynch, it's really interesting to see how the public actually views her. These are both screenshots of two different service women, of Jessica and Lindy England. Jessica, when this screenshot was taken a few weeks ago of Google, and it's the little Google box that comes up on the right side when you type in someone's name. And what's really interesting is that, like, Jessica Lynch was an Army soldier, but they found it necessary. But not when I say they, I mean it's interesting because we know that Google populates things based on what people search for. So it's very interesting to me that this biography specifies that shows almost all of her photos, all but 2 photos are of her in civilian clothing, and it specifies that she received the U.S. Glamour Award. Not that she received a bronze medal or any of her military awards, but that she was she represents that she received the U.S. Glamour Award for Women of the Year. What's really interesting too is when you compare that over to Lindy England, and if you don't know who Lindy England is, she was actually one of the soldiers during the controversy over when there were controversial photos taken of inside of a prison in Iraq of them torturing and harassing prisoners. The reason why I use these two, Jessica Lynch and Lindy England, is because both of these individuals were used as examples of why women should not serve in combat, because either they were either considered too weak to serve, and it was a risk because they could be captured and they might be raped, or something might happen to them, or they're considered too disruptive to military discipline and morale, which is what Lindy England represented. Both of these individuals, both of their stories were brought up in congressional hearings before the repeal of the ban on women in combat services. England is interesting because, more specifically, because she was only one of several dozen individuals who were part of the scandal within the prison. But she became the scapegoat and the face of it because she was a woman. The media actually really demonized her as an individual versus actually taking into context the entire group that participated in these behaviors. So basically all of that is to say that the military may be legally inclusive of women, but women have yet to reach social and cultural integration within the military population. This is a saying that I've heard so many times: men are soldiers, but women are female soldiers. When we talk about the glass ceiling within within our society, it's actually what we call it in the military. We call it the Kevlar ceiling. Basically, there's only so much that a woman can be in the military. There's almost so much that you can do, and it's just so hard. It's so hard to reach beyond that because of the actual culture of the military and the very patriarchal system that's already in place. Of course, there's always, there's a lot of other issues that come into play with, the actual culture of the military and how that impacts the health and wellness of our service women. Obviously, physical performance, alcohol availability, the living arrangements, the types of services and deployments that our military women have to go through. Things like prescription practices and alcohol availability both play into what we're seeing concerning trends in substance use within our female veterans. Our post-deployment health assessments and our policies regarding drug testing, those are very key factors in what we're seeing currently with our service women. One thing that's really interesting about that, I want to touch specifically on the post-deployment assessments, is that there's a policy in place where any service person who goes on a deployment, they get a pre-health assessment and a post, and then they get a secondary post-assessment 6 months after. But what's interesting is that and I'm going to say from my own experiences, my post-assessment was basically 15 minutes of sitting inside of a waiting room and the doctor coming out and asking me, "Are you good?" and then signing off on a piece of paper. Now that's not the same across the board. That was just my own personal experiences. However, the actual assessments that are being done are not conclusive. They're not as comprehensive as they actually need to be. And only doing a post-deployment, a single post-deployment assessment and then a 6-month assessment is not comprehensive enough for our all of our service people who are going out into these combat operations and actually engaging in these conflicts. Also, we have the military to civilian transition. That's a key factor that plays into what we're seeing with our women veterans. Studies have been done that show that military women who have comprehensive transitional services when they're getting out of the military and going into the civilian sector, that they actually do better. They're less likely to be unemployed, they're less likely to become homeless, and they're more likely to, they're less likely to live under the poverty level. All right, so I want to talk about the health, not just the behavioral health, but just the healthcare, the health and wellness of our service women in general. I don't have a slide on reproductive health care needs of service women and veterans, but I think it's very important to be able to talk about that for a few minutes. There's a real dearth of services, and that's really existent and really shows what a male-dominant culture the military and the DoD and the VA is. There's been a lot of pressure recently for Congress, the Department of Defense, and the VA to re-examine their health services and expand their services for women and women veterans and service members, and to become more inclusive of women, which includes access to reproductive health services. It's really important to remember that it wasn't until the 70s that the DoD actually stopped kicking women out of the military for getting pregnant. However, it wasn't until about a decade ago that they actually made efforts to keep women in even if they were pregnant. It wasn't until 2010 that emergency contraceptives were available in military clinics and hospitals, and it wasn't until 2012 that TRICARE, which is the military health care insurance, it wasn't until 2012 that TRICARE expanded to cover abortion just in the case of rape and incest. There's also currently there's actually a ban on service women using private funds to access contraceptives and pay for abortions at outside of military hospitals. At military hospitals, so a lot of times, and even in military hospitals, so they have to use their own money basically if they're going to go off base or if they're going to go to a facility that's not covered. However, actually not allowed to do that. It happens anyways. When we talk about VA care, I really want to make a statement that I'm going to commend the VA for their actual their effort that they've put into the past 2 years in expanding their services for women and actually targeting women as a priority population for them to provide services to. They've made some really notable strides in women's health care. But unfortunately, many times gender-specific services just don't exist at VAs, or they may be just difficult to access. Also, some women report that the VA is unwelcoming. Their facility is unwelcoming or uncomfortable, or they don't consider it a safe place, and that they have encountered staff or patients who are insensitive or inconsiderate. There's a higher percentage of female veterans who actually use VA care. It's around 40%. And they're but however, they are more likely than men to use non-VA care while they have a service-connected disability. Women veterans are substantially younger than male veterans, and they have unique needs. They have unique health services, and they need unique services. It's really interesting when talking about the services that the VA provides, as well as that other clinics provide, because historically, disability claims for women are less likely to be approved than disability claims for men. They're generally given lower VA claims compared to men. Usually with women it's between 10 and 30%, and with men it's between 70 and 100%. There was actually some investigations that went on within the VA, and there was also a Freedom of Information Act lawsuit by the Service Women's Action Network, and it showed that between 2008 and 2010, 2 out of every 3 PTSD claims related to sexual trauma were rejected. All that being said, one of the biggest barriers to offering comprehensive services is the lack of data. There is not enough information. There is not enough data collected on women in combat. There's not enough data collected on what is actually going on with our service women. All military members are exposed to traumatic events in general within the military, but especially during times of war. Honestly, we really need to see more studies come out. We really need to have some. We really just need to see a lot more information. All right, so going back to what I said about the need for transitional services between civilian and military, women veterans are less likely than non-women veterans to live in poverty. However, they're more likely than male veterans to be unemployed. 36% of women veterans between the ages of 18 and 24 are unemployed. These 18 to 24-year-old female veterans are most likely they served one enlistment, so between 3 and 4 years, 3, 4, 5 years sometimes, and then they got out of the military, or they were separated due to something out of their control, or because of a negative, or they received a negative discharge. It is a really interesting thing to say that 38% of women veterans, of all women veterans, actually work for local, state, or federal governments compared to the 18% of non-veteran women, and that's across the board nationwide. Of course, we know there's a disparity in the actual earnings of women and men, between women and men. The same goes for veterans. I want to let you guys know that young women are at a very high risk of using the shelter system, especially young veterans in poverty, young women veterans in poverty. Young women veterans are more than twice as likely to be homeless than their non-veteran counterparts. And young women veterans in poverty are almost 4 times as likely to be homeless than their non-veteran counterparts. It's of course, and also, 38% of homeless women veterans have a minor child living with them, compared to 8% of male veterans who are homeless. So with substance use, there's some gender differences between drug use within the services. Women in the military are more likely than their male counterparts to use drugs. Army women are more than twice as likely as men. In the Air Force, Coast Guard, and Navy to have used any illicit drug, including prescription drugs used non-medically in the past month. Prescription drug use is among women on active duty is more than 4 times the rate than for civilian women. And like I said before, they have higher rates of past month use compared to men. With alcohol use, women are less likely than men to abuse alcohol within the military, which is an interesting statistic compared to the fact that they're more likely to use illicit drugs. So PTSD is a really interesting thing to talk about. There is not, once again, I want to reiterate, there's not enough data on this. They have not studied this enough mainly because of the fact that they could not classify women as combatants prior to last year. So when you talk about PTSD, they couldn't connect it to combat-related service. So even if a woman was in a combat zone and she came home and she was being diagnosed or treated for PTSD, it wasn't considered related to the combat. It was considered related to whatever else. We do know that women are more than twice as likely to develop PTSD than their male counterparts in the military. We know that overall, PTSD diagnosis rates right now are skyrocketing. They're almost 4 times as high. The past 3 years, they've increased by almost 4 times. 20% of all of women veterans of Iraq and Afghanistan conflicts have been diagnosed with PTSD. That's as compared to 27% of Vietnam veterans, women Vietnam veterans. So military sexual trauma, I'm pretty sure that everyone would agree that it could be considered an epidemic. The reports nearly doubled over the past year, which is a good thing. We're happy about that. That means that more people are reporting. However, we're still estimating that 85% of all sexual assault crimes are going unreported within the military. It's really interesting to note that women make up 16.5% of the entire active duty force, but 47% of all sexual assault victims. Basically, a woman who's in the military is more likely to be sexually assaulted by another service member than they are to be physically injured or killed in the line of duty. You know, and there's a lot of conversation about why this is going on, and actually it's created a lot of controversy more recently about whether or not the military or the DoD is properly addressing perpetrators, whether or not they're actually reporting the right way, whether or not they're prosecuting perpetrators. It is important to note that there are now, as of this year, the DoD, the Uniform Code of Military Justice, which is the law of the DoD, they actually implemented mandatory minimum punishments, which prior to this year there were none. Those minimums were a dishonorable discharge for enlisted service members and then a dismissal for officers. There was also an addition to military law that stated that accused must appear before a court-martial with no opportunity to be tried at a special court-martial. This is really important because prior to this article being implemented, in the military, a person could be accused of a sexual assault, but it never went any further. Basically, the report would be placed into the commanding officer's hands, and if he didn't deem it, if he didn't think that it was substantiated, it never went any further. It was up to the commanding officer alone. Also, Congress this year has changed the regulations in regards to just the disposal of these sexual assault cases with adverse administrative actions, which basically was when an individual would be accused of a sexual assault, the military command that he was at was allowed to give them non-judicial punishment. Congress did mandate that all sexual assault and rape cases are to be tried only by court-martial. They're no longer allowed to do that anymore. It's also really interesting that this year they also changed the statute of limitations on sexual assault and rape. There used to be a 5-year statute, and now there's a statute of limitations, and now there's no statute of limitations at all. They completely did away with that, which is really great. All right, so to follow up on that, I really want to talk about this. There's been a lot of surveys and a lot of conversation about why this is going on, about why sexual assault is so prominent right now. What's actually going on in the military? I think it's very interesting to know there's been several studies and reports done on this that in the early Iraq and Afghanistan war, there was a decrease in people in recruitment. So people were not joining the military. Over 17% of all enlistments between 2003 and 2006 were considered morality waivers, which was basically which was basically that if you had criminal misconduct on your record, any type of criminal offense on your record, they could waive it. They allowed you to waive it. That's very interesting because the types of actual convictions they allowed to join the military. There was over 4,200 convicted felons who enlisted during that time. On top of that, and of these morality waivers, these are only that I'm talking about here on this screen, on this slide. These are not including drug offenses. I made sure to separate those out because that's the biggest thing everyone thinks about when they talk about how the military allows people to join the military with criminal offenses. They just automatically think that they're talking about minor misdemeanors, minor possession, and that's not what we're talking about here. We're talking about, let's see, if you look at this number, 43,977 of these recruits had been found guilty of a serious misdemeanor, including robbery, burglary, negligent homicide, assault, and battery. Of the felons, those included individuals who were found guilty of vehicular homicide, rape, statutory rape, unlawful sexual contact, aggravated assault, assault with a deadly weapon, and the list goes on. What's even more disturbing is that the DoD still has no systematic tracking or monitoring of recruits who signed up with these, who joined the military with these types of waivers. Basically, once you join the military, that's all that happened. Once you received your waiver, it was like you no longer had a criminal record in regards to the military, as the military saw you. It was really a reckless, in my opinion, and in a lot of the studies that have been done, a lot of the reports that have been done, it was a real reckless expansion of what morality waivers were initially intended for. It wasn't until 2009 that the military, the DoD, met these recruiting goals. But what's really interesting is that the DoD has never, ever tried to track or has tried to collect data on whether or not these perpetrators that we've been seeing in the past 5 years, whether or not any of them have been, were enlisted with these morality waivers. So to continue on, women veterans have higher rates of depression than men, although they do have lower substance use disorders. There's not enough suicide data collected. Most of the studies that have been done about suicide within the military population and within the veteran population focus more on the differences between veterans and non-veterans. For example, like the suicide rate between all veterans is estimated to be 66% higher than that of the general population. Unfortunately, we need more data on that. We need to be tracking that, and this year is actually the first year that the VA will be reporting on that. Women, it's also important to look at, I think it's also very interesting to look at the fact that women who are deployed with combat exposures are were 1.78 times more likely to develop eating disorders and 2.35 times more likely to lose an extreme amount of weight compared to women who deployed but did not report combat exposures. That was merely, that was there was a series of studies that was done on that. However, once again, there's not enough data on whether or not on actual eating disorders within the military. We do know that men are more likely to have eating disorders than women, but there's never been any further discussion or further studies on that. Okay, so that is it. Went a little faster than I thought. If there's any questions, I'll take them. And I also have a series of references. I know that the PDF file of this is going to be posted, so if there's any questions or concerns, feel free to follow up with me.
Yeah, this is Chris. I find that all really fascinating. Do you see things changing? You mentioned so many things that that haven't been studied yet. Do you see any grants being offered or people coming forward to fill in a lot of those blanks?
You know, there's been a lot of pressure recently, actually, on both by Congress and with other organizations like the Service Women's Action Network, the Service Members Legal Defense Network, the ACLU even, as well as other, you know, the Department of Health and Hospitals and SAMHSA as well. So there's been a lot of pressure on the DoD to do these type of things. They have been expanding. It is interesting that it's great that the VA is actually going to start reporting on specifically on women's suicides. That the VA is actually required to report now on the gender disparity in actual access of services. So there is progress being made. Obviously, not as fast as we'd like to see it happen, but yes, I do see that there is progress.
Okay, that's great. At least we're moving in the right direction. I know that there's some people on the webinar today who are from the Louisiana SASE Expert Initiative, and if any of them would like to either send me a question or comment in the chat or questions box, or better yet, if you'd like to speak with Ariel, please raise the hand icon next to your name. Also, there's people here from other states as well, so if you see things are different in your state, or maybe some measures are being taken in your state, or some issues that have come up in your agencies, please let us know that as well.
Yes, definitely. It'd be great to hear from other states, see what's going on.
Well, if people are typing, I haven't gotten anything yet. Okay, good. We have a couple raised hands. I'm going to start out with Rhonda Jefferson. Rhonda, I have you unmuted now.
Can you hear me?
Yes, just turn off the speakers on your computer.
Okay. Is that
because
better?
we're getting the feedback.
Okay.
Yes, that's fine.
Okay. I just want to say thank you, Ariel. You did a beautiful job. It's quite alarming, all the statistics you share with us today regarding the issues of substance use and even the sexual assault. With the SASE initiative in Louisiana, we may need your input and feedback on the resources in the Louisiana area if we come across those particular female soldiers. So I know you have a list here of references, and that's a good thing. But we've come across some females who have not always wanted to share that they even have mental health issues, and they may have had some substance abuse issues as well. They're not wanted the military to know. Have you come across a lot of those individuals as well?
Yes, actually, well, I would say there's a lot of that going on across both genders. There's a real issue when you're talking about active and reserve military members, both men and women, because of the lack of confidentiality within the military.
Mm-hmm.
While the general policy is that if you don't have, is that if you do receive services for a behavioral health problem, that's not going to be negatively, that's not going to look negative on your record. However, things like that, it wasn't until, it's interesting to think about how, like, it wasn't until last year that if you were receiving counseling services, or if you were on some type of prescription for some type of depression or anxiety disorder, a military member actually could lose their security clearance as of even up to last year. And it wasn't until this year that that policy was changed. So there's a lot of stigmatization still within the military. I mean, within our nation as a whole, but within the military, I think it's a little escalated because of this extreme pressure to be combat ready and to be useful and to be at the peak of their game.
Mm-hmm.
So
yeah.
I see that a lot, actually. There's definitely a need for more resources. And actually, let me put up my contact information. I know you have it already, Rhonda, but for anyone else, that definitely, if anyone is looking for resources, I'm more than happy, specific resources, I'm more than happy to share some with them. Or if anyone has any resources they'd love to share with me, I would love to receive them.
Okay. Thank you again, Ariel.
No problem. Let me try and... Oh, that didn't work. There we go.
Sharon, you can speak with Ariel now.
Hi, can you hear me?
Yes,
Yeah.
thank you.
Okay, thank you very much. It's an excellent presentation. I'm a veteran myself. I'm also a clinician, a mental health provider here in Louisiana. And we were the last Women's Army Corps. And I was with the crew that we were trained, we're the first ones to be trained with the men. We were kind of the guinea pigs to see what would happen years later.
Oh, how neat.
So I greeted the crew that came back from Vietnam. And my concern after hearing this is, wow, things have not changed. It's scary. It's really scary. I have a son who's National Guard. He's a staff sergeant here in Louisiana. And I listen to him when he shares and some of the soldiers where he's working with. And to hear that I'm hearing some of the same things today that when I served over 35 years ago, that's a major concern.
Yes, ma'am.
And, you know, I'd love to be a part of your initiative, so, you know, I'll be contacting you, but thank you for the presentation.
Great, thank you so much. Yeah, I mean, I like to think that we've made some progress. There's so much work that needs to be done. There's so many changes. A lot of in the research I've done, it seems like the fact that the military is such a closed hierarchy, the entire structure of the military is a closed hierarchy. So those changes are so slow. They have to be top down, and unfortunately, we haven't seen that much progress in the upper leadership of the military to require local commands to address these topics.
Okay, thank you, Sharon. I'm going to mute you now. And I do have somebody who typed in a question. What advice do you have for social workers working with women veterans, specifically OEF, OIF veterans?
Oh, wow. So I could do an entire presentation just on that. So it's really interesting looking at generational differences, and I'm glad you specified specifically OIF and OEF. Younger female veterans like myself, there's a completely different set of challenges that we face. Our conflicts have changed. The way we engage in operations have changed. It's very important to be aware of that. You know, how you the actual culture of the military has changed in how we operate. You know, how we interact with other nations has changed. The actual branches themselves, it's very important to understand the differences between the branches and understand, where your clients are coming from. Obviously, the challenges that face an older veteran who served in the Air Force is going to be completely different than the challenges that, say, I faced serving in the Navy on active duty more recently. So it's just very important to be aware of those differences, and to make sure that you have an environment that is inclusive of female veterans. A lot of female veterans are reporting that they don't feel that treatment facilities are inclusive of women veterans specifically. They feel everything is geared towards veterans, but with the idea that those veterans are men. So just making sure that your policies, your procedures, even your media campaign, any media campaigns you do, even your brochures or how you market yourself, that you portray yourself as female friendly, and specifically women veteran friendly. I hope that helps. Any specific questions? I'm more than happy. Send me an email, and I've done social worker training before. We did social worker training for all of the school board, and I've done it for the judicial districts as well as several different treatment facilities. So if there's anything specific, feel free to email me and let me know.
That's wonderful, and I will put your email address too on the follow-up email that I'll be sending to all the attendees. And that was my last question that I received here was this webinar is people can earn one free NADAC or Pennsylvania CADC certificate for attending. And later this afternoon, all attendees will receive an email from me that will have attached the certificate, the free certificate, and also a link to where you can get this recorded webinar and also view and download the slides, which will be in a PDF format. Also in that email, and in one you'll be getting right after this webinar from GoToWebinar, we ask you to complete an evaluation. We are federally funded through a grant, and one of our requirements is to give them feedback on the presentations we do, and that's all based on your evaluations. And so we really need everybody who is listening to do one of those. It's about 2 minutes. They're anonymous, and we appreciate that. Now, Ariel, we really want to thank you for coming forward and presenting this, and I know you sent me a whole list of other webinars you can do, and who knows, we might be contacting you again for one of those other great topics. So in the meantime, I said people will be able to download and view the webinar again and also get your slides. So thank you so much. It was a great webinar, extremely informative.
Thank you so much for having me.
Sure, thank you. And at this time, since we're 1 minute over right now, we will close the webinar off for everybody. Thank you very much for attending.
Thank you.